Welcome to This Explainer. Today, we're diving deep into the massive systemic risks that drug retailers face when it comes to the management of controlled substances. We're pulling our insights directly from the SASB standards for the healthcare sector, specifically the Drug Retailer Standard. This isn't just about counting pills. It's really about uncovering the huge liabilities hidden in plain sight across extensive retail networks.
It's a pretty staggering question, right? How do we actually measure the corporate cost of the illicit drug trade? Usually, when we think of the illicit drug trade, we picture street-level enforcement. But today, we're flipping the script to look at the corporate side. We're going to see exactly how sustainability standard setters force major publicly traded companies to quantify their failures in keeping highly controlled, dangerous drugs off the black market. So here's our roadmap for today. We'll cover the high-volume retail network, risks of controlled substances, adverse social externalities, the regulatory enforcement reality, measuring the financial impact, and finally, protecting long-term shareholder value. We're following a stark corporate risk journey, moving from the physical reality of retail networks down to the devastating social impacts and ultimately how investors actually measure these liabilities.
All right, Section 1, the high-volume retail network. Let's look at the sheer baseline reality of modern pharmacies.
I really want you to think of a drug retailer not just as your local corner store, but as a massive, highly complex distribution network. According to the SASB standards, this industry is defined by the incredibly high volume of controlled drugs processed and dispensed. We're talking about companies operating thousands of locations, moving an extraordinary amount of restricted product through extensive retail and distribution networks. It's an absolute logistical marvel. But that very scale introduces a profound, immense level of risk when we start talking about controlled substances. Moving to Section 2, risks of controlled substances. Now, what actually happens when you combine highly restricted, potentially dangerous substances with this immense retail scale? Well, the SASB standard clearly lays out the three primary vulnerabilities at this scale. When you're processing millions of prescriptions, the main risks are the outright theft of drugs, the loss of inventory through poor tracking or mismanagement, and the illegal dispensing of these highly controlled substances. And let's be clear, these aren't just minor operational hiccups, they are massive security failures within the supply chain. Section 3. Adverse social externalities. This brilliantly illustrates where the sterile world of corporate operations completely collides with devastating real-world realities. When those vulnerabilities we just talked about, the theft, the loss, the illegal dispensing actually happen, it results in what the standard calls adverse social externalities. That's a very clinical financial term for severe public health consequences. We're talking about fueling drug abuse and actively contributing to the illicit drug trade. Because if a drug retailer fails to manage its inventory, those missing controlled substances don't just vanish into thin air. They end up in communities, creating a very real, very dangerous public health crisis. Section 4. The regulatory enforcement reality. Because these public health stakes are just so incredibly high, the regulatory response to mismanagement is exactly that, swift and punishing. Regulatory enforcement absolutely does not just tap these companies on the wrist. Jurisdictional drug monitoring programs and regulatory bodies are watching like hawks. If a retailer fails to manage controlled substances, the enforcement reality hits them with a massive two-pronged hammer. Crippling monetary fines on one side, and the complete suspension of their operating licenses on the other. And a suspended license means a pharmacy literally cannot operate. It's a total existential threat to the business model at that specific location. Section 5, measuring the financial impact. So the really crucial question here is, how do investors and compliance officers actually track this risk before it completely destroys a company's bottom line? That brings us to these SASB standards themselves, which are now under the stewardship of the International Sustainability Standards Board, or ISSB. These standards provide a highly specific framework to force transparency on these massive sustainability-related liabilities. They make sure that companies can't just sweep a major regulatory fine under the rug in a dense financial report. Instead, they have to pull it out into the light and show the specific financial damage caused by mismanaging controlled substances. The standard uses a very specific metric code, HC-DR-260A.2. It might sound a bit like a droid from Star Wars, but it's actually a strict quantitative measure. It requires companies to report the total amount of monetary losses tied to controlled substance legal proceedings, specifically in their presentation currency. It's a hard, undeniable number that tells investors exactly how much cash the company is bleeding due to failures in securing dangerous drugs. And you have to notice the sheer scope of what must be reported here. The standard dictates that these monetary losses have to include all liabilities to opposing parties. So this means settlements from civil judgments, disgorgements and penalties from regulatory proceedings, and outright criminal restitutions. Whether it's a government, a business, or an individual bringing the suit, if the company pays out because of a controlled substance issue, it goes right into this metric. No exceptions. But the standard setters are actually really clever here. The standard specifically excludes legal defense fees and expenses from this total amount. Why? Well, because they want the metric to purely reflect the penalty of the failure, not the cost of the lawyers hired to defend the company. By stripping out the legal fees, the metric provides a crystal clear picture of the actual punitive and compensatory damages the company incurred. Furthermore, companies can't just post a massive penalty number and walk away. The SASB standard forces them to provide the whole story behind the data. They are required to describe the nature of the loss. Was it a settlement, an order issued after a trial, a guilty plea, maybe a deferred prosecution agreement? They must describe the context, for example, explicitly stating if the fine was due to a failure to report a theft. And crucially, they have to detail the exact corrective actions they took in their operations, management, training, or technology to fix the leak and ensure it never happens again. Section 6. Protecting long-term shareholder value. Let's move to our final section and see how this all builds to the ultimate corporate mandate for drug retailers. The overarching thesis here in the SASB standard is genuinely profound. Implementing strong internal management of controlled substances isn't just about checking a box for regulatory compliance. It's a dual mandate. By securing these drugs, retailers simultaneously mitigate a massive public health crisis, keeping illicit drugs off the street, while directly protecting long-term shareholder value from devastating fines and suspended operating licenses. Good public health policy in this industry is quite literally good business. So the next time you walk into a drug retailer, I'm going to leave you with this to ponder. Behind the bright lights and the endless aisles of merchandise, are their internal controls really strong enough to keep these highly controlled, dangerous substances safe? Or are they a massive regulatory liability just waiting to hit the balance sheet? Understanding these standards really changes how you look at the entire industry. Thanks for joining me on this explainer, and keep asking the tough questions.